When you are treating and managing patients with chronic ulcers, wounds or conditions of the skin, Viscopaste zinc oxide paste bandage may be your product of choice to help with the healing journey. The anti-inflammatory and antimicrobial properties of Viscopaste help to soothe and calm sore and irritated skin, which means that your patient finds them comfortable to wear, allowing them to get on with their daily activities without worrying about their wound or skin condition. If this is the patient's first application, a patch test is advised. Cut a small piece of bandage and apply to the patient's back. Cover it with a small dressing for 48 hours and then check for any unwanted reaction. If all looks good, you're okay to start the treatment. Viscopaste bandage is non-elastic and therefore does not stretch. To maintain your patient's comfort, it's important to apply the bandage correctly. And there are two methods of application, and the method you choose will depend on the area of the body to be dressed. Both methods are really simple with a little practice. First, the cutting technique. You may wish to use this method if you are treating a smaller area of the body. After preparing the skin according to your treatment plan, cut appropriate lengths of bandage and apply them to the affected areas. If you are applying the bandage to a limb, you may wish to apply the strips of bandage vertically rather than wrapping them around the limb. The second method of application is the pleating technique, and this is always used when dressing a larger area of a limb. We use this method to prevent the zinc paste bandage from becoming tight if swelling should occur. It is advisable to start at the base of the toes and work all the way to the knee, or from hand to elbow if you are dressing the patient's arm. On the lower limb, start at the base of the toes by taking the bandage one turn around the foot to secure it in place, and then make a small pleat or fold. Return the bandage in the opposite direction before making the next pleat on the other side of the foot. Apply the bandage loosely around the heel and ankle, pleating with each turn, and then continue up the leg, stopping just below the knee. Be sure to cut off any excess bandage. We recommend that you make the pleats off-centre to either side of the limb, as this will avoid any risk of pressure over the bony prominence of the tibial crest. Smooth the bandage over and check for any gapping. The same technique is used when dressing an arm. When in place, check that the bandage feels comfortable and unrestrictive for your patient. Both methods of application will require a secondary dressing to secure the Viscopaste bandage and to protect the patient's clothing. This may be a simple retention bandage, a dressing pad, tubular bandage or a garment, or compression therapy in the form of bandages or a wrap. Once applied, Viscopaste can be left in place for up to 7 days of wear time before reapplication. On removal, gently unwind the bandage.